This podcast has been sponsored by Ardelyx. Maintaining a healthy gut is key for overall physical and mental well-being. Whether you're a health-conscious advocate, an individual navigating the complexities of living with GI issues, or a healthcare provider, you are in the right place. The Gut Health Podcast will empower you with a fascinating scientific connection between your brain, food, and the gut. Come join us. We welcome you.
Hello, friends, and welcome to the Gut Health Podcast, where we talk about all things related to your gut and well-being. We are your hosts. I'm Dr. Megan Riehl, a GI psychologist.
And hello, I'm Kate Scarlatta. We have an exciting podcast for you today. We're talking all about bloating. We'll get into the complexities of this troublesome symptom that every one of us deals with from time to time. We'll learn about what causes bloating and how to treat it. Today's guest is world-renowned gastroenterologist Dr. Brian Lacy from Mayo Clinic Jacksonville, Florida. Dr. Lacy focuses his research and clinical interests in disorders of gastrointestinal motility. His scientific articles on bloating are my personal go-tos, especially for clinical tips with my patients. He is the author of nearly 200 peer-reviewed articles on GI motility disorders. As well, he is the past co-editor-in-chief of the American Journal of Gastroenterology.
Welcome, Dr. Lacy.
Well, thank you so much for being here. I'm just excited as you guys. This is great.
Yes. So as we kick off today's podcast, we want to start with some myth busting. So what is a common misconception about gut health that you would like to dispel with our audience?
I think that's a great question. I think there are a lot of myths and misconceptions about gas and bloating, but one of the ones I hear most commonly from my patients is that they firmly believe that they produce much more intestinal gas than anybody else, and that's the root cause of all their symptoms of gas and bloating. But that's really a misconception.
All right. So we're going to get into the details here.
Great.
Let's dive in. What is bloating and how does it differ from abdominal distension? Tell us a little bit more about this.
Yeah, and I think that's a really important point for all of your listeners because it makes us think about the symptoms differently, and it makes us think about the underlying pathophysiology differently, and therefore likely thinking about the treatment differently. So bloating, which is incredibly common, as you've already mentioned, is a sense of being gassy. It's that sense of gas on the inside, bloating. And it's very prevalent. And we talk about, 14% of adult Americans having symptoms of bloating within the last week. Distension is the physical manifestation. And patients may come in saying, I look 3 months pregnant. I look 6 or 9 months pregnant when they're not. I look like I've got a basketball in my belly. Frequently, they overlap, and people may have symptoms of gas and bloating, but they may also then describe periods of significant distension. Pathophysiologically, they may exist on a bit of a spectrum, but to some degree, pathophysiologically, they may also be a little bit different. So it's good to kind of tease that out with your patients.
So you're saying, this is a pretty common symptom in the general population. And how common in IBS or in SIBO, small intestinal bacterial overgrowth?
Yeah, great question. So there's a recent nice study from Cedars-Sinai published about a year ago, surveying nearly 90,000 patients across the United States, thought to kind of capture the general U.S. population. And in that sample size, one of the questions they asked about was gas and bloating, and 1 in 7, 14%, said within the last week they had symptoms of gas and bloating. And as you mentioned, this is very prevalent in people with IBS symptoms, whether IBS and constipation or IBS and diarrhea, or those who go back and forth. And some studies have shown that 60 to 70% of patients with IBS have overlapping symptoms of gas and bloating. It's not part of the formal definition, but it's so common, I always ask about it. And I think most healthcare providers and psychologists and dietitians ask about it as well. SIBO, small intestinal bacterial overgrowth, is interesting. The definition is that you have too many bacteria in your small intestine where they don't really belong. We have a lot of bacteria in the colon, as everybody knows, right? We have 4 pounds of bacteria in your colon. We don't have a lot in the small intestine. But the definition of SIBO is really just more bacteria than usual. They don't talk about symptoms at all as part of the definition. Probably a mistake. That said, most patients with SIBO, small intestinal bacterial overgrowth, come in because they have symptoms of gas and bloating, the vast majority. The occasional SIBO patient comes in just with chronic diarrhea, but most have symptoms of gas and bloating, you're right.
So everyone gets bloated once in a while. And I think people think, I'm bloated, it's terrible. You eat a large meal, overdo beans, whatever, you can feel a little bloating. But as a gastroenterologist, when do you escalate a workup based on an individual's symptoms of bloating? Like, what are some red flags?
Yeah, that's a great question because you're so well aware of healthcare efforts, especially for something like ovarian cancer. And they mention that bloating could be a sign of ovarian cancer. And they're really trying to help the public and make young and middle-aged women aware of this potentially disastrous, fatal disease. The problem is bloating is so prevalent, it extends across all different disease states, whether constipation or diarrhea, gastroparesis, functional dyspepsia, IBS, as we talked about. It is so prevalent, it overlaps almost everything. And so you have to be very careful about a non-specific symptom such as bloating, feeling gassy. You're right. People have it all the time, obviously. And then thinking, wow, that symptom must represent something bad or dangerous, because rarely does it represent something dangerous. So your question really is, how do you tease out that non-specific symptom and make sense for all of our listeners who are worried it could represent something bad? So then what I want to focus on is what are some other warning signs maybe paired up with it that would make me want to investigate further, such as, are you losing weight unintentionally, more than 10% of your ideal body weight? Is there a family history of a GI malignancy or ovarian or uterine cancer? Are you anemic? Is your blood count too low? Do you have significant other warning signs, such as maybe sweats at night, or you have significant abdominal pain that doesn't be relieved by having a bowel movement or urination? Then I might want to investigate, and certainly a simple investigation might be an abdominal ultrasound or a pelvic ultrasound to get the ball rolling.
Perfect. In your practice, what are some of the common sort of related disorders that you see that are associated with bloating, just every day as a gastroenterologist?
Right. So if we were to make up a list of common causes of gas and bloating, we could probably quickly list 25 or 30 between the three of us in the next minute. But to help our patients and to help other healthcare providers, I try to really focus on 5 big areas. And I think that encompasses about 90 to 95%. So I start thinking about diet and dietary causes of gas and bloating. Fortunately, we have an expert right here on the call, Kate Scarlata, who can educate us about diet and dietary causes of gas and bloating. I think about constipation and bowel habits. Again, some patients with diarrhea have bloating, but it's much more common with constipation. And as I explain to patients, if you're having difficulty evacuating stool, don't be surprised you have difficulty evacuating gas as well. They're handled similarly in many ways. As you've already mentioned, I think about small intestinal bacterial overgrowth. And depending on which study you read, the prevalence may be 1 in 25 people or 1 in 5 people. So it may be much more common than we think. We have a wonderful psychologist on the phone call, Dr. Megan Riehl. And then I start talking about visceral hypersensitivity. As I mentioned, most patients don't make more gas than other patients. 1 to 2 liters per day on average, by the way, is what the average American produces in terms of intestinal gas. But some patients sense normal amounts differently. They sense that little bit of gas differently, and they sense it as pain, bloating, discomfort. Lastly, there's a smaller group of people who have kind of this funny reflex, and I actually tell them they have a wiring problem. We call it abdominophrenic dyssynergia, phrenic referring to both the phrenic nerve and the diaphragm. And to briefly explain that, Normally, if you get some gas in your GI tract, whether the colon or the small intestine, you sense that gas. Normally what happens is your diaphragm ascends. That makes your belly cavity bigger. Your diaphragm goes up higher into your chest, makes your belly cavity bigger, as you both know. And subconsciously, your external obliques and abdominal wall muscles contract to keep your abdominal wall flatter. But some people literally are wired differently. I tell them they have a wiring problem. It's an electrical problem. And when they sense that gas or stretch or distension, instead what happens, their diaphragm descends. Now their belly cavity is much smaller. And subconsciously, their external obliques and abdominal muscles relax. And now they've got this immediately protuberant abdomen. They're very distended.
So I've got the expert. I'm going to pick your brain a little bit. Sometimes I'll teach patients diaphragmatic breathing to help with their bloating. What you're just describing, can diaphragmatic breathing reset some of that, do you think? Or maybe make it worse?
I think it can definitely help reset it. However, so for all your listeners out there, this is the problem talking to somebody who knows the field so well. If you were to challenge me, what I'm talking about is actually Dr. Megan Riehl, not me. If you challenge me and say, where's the data? We don't have the data. This is routinely practiced by a lot of healthcare providers, and generally the clinical experience is good. That diaphragmatic breathing, which can be tricky to teach, as you know, Dr. Riehl, but when taught appropriately and when performed at home, we recommend before meals, so at least 3 times a day, can be very effective at treating gas and bloating. But we don't have great clinical data. However, if you ask me the same question in 1 year, we just started a pilot study here, prospective, randomized. We're going to give you the data in 1 year's time.
Perfect.
Awesome.
Thank you. This is
How's that?
great
How's that
news.
for a shameless plug?
Oh, no, that's not shameless. We like to let our listeners know what's coming down the pipeline. That's
Yeah.
awesome.
Yeah, I think we know that there are lots of evidence-based strategies for IBS, and we also know that bloating is a very common symptom of IBS. But when people are looking to expand with their dream team, we call it, working with a dietitian, working with a psychologist, I do tell my patients, that I've got a lot of evidence to suggest that gut-directed hypnosis or diaphragmatic breathing is very helpful for bowel symptoms, including your diarrhea, constipation, reducing that visceral hypersensitivity. But I find, and I think some of my colleagues feel this way when somebody's presenting specifically with their bloating, we all kind of are like, okay, buckle in. We can help you. We definitely have strategies for you. It's just the evidence isn't as strong. So we're really going to personalize things. So that's what I think you're just highlighting, that bloating can be tricky, but there are different strategies out there that can be helpful. And then you're going to produce the evidence-based literature that we really need to back up what we're doing in clinical practice.
I like, Megan, so much of what you said, because I think all of us at heart, we're scientists. We want to understand how things work, why symptoms develop. I think at heart, we're all educators, because what do we really want to do every day? We want to educate our patients, right? We want to reassure them. We want to make them feel better. And we try to use the best data from the literature. And at least in this space, we don't have as much data as we would like. When you think about it, it's such a common problem, but it's actually understudied. And so, hopefully in the next year or so, we'll get a lot of really good data. And you can say now, based on this study, we can tell you with very strong feelings that this is what's going to work for you.
Yeah. So can you tell me a little bit about how you describe how stress may impact bloating symptoms for your patients?
Yeah, that's complicated, isn't it? Because,
Right.
Can we set the stage for 30 seconds and talk about the brain-gut axis?
Yes,
So I'm
please.
sure you've had other speakers on this wonderful show talking about the brain-gut axis, but for maybe listeners who weren't there before or aren't quite as up to date, think about this brain-gut axis. And what I mean by axis is this bi-directional pathway between the brain and the gut. And what I tell my patients is that this brain-gut axis, this bidirectional pathway, signals from the brain to the gut and the gut to the brain. You have more nerves in your GI tract than the spinal cord. In fact, you have 5 times as many nerves in the GI tract than in your spinal cord. The GI tract is a sensory organ, and 90% of the nerves in the GI tract are sensory in nature. So you could imagine that if you're having gut symptoms, it sends signals to the brain. brain is affected. Similarly, if you have brain signals and stress or emotion, it can affect your brain, which can affect your gut. So you could imagine, we've already discussed the fact that with these disorders of gut-brain interaction, such as IBS, your gut is sensitive. Your gut is wired differently, and patients feel things differently than other patients. And so you could imagine with this brain gut interaction, if you are getting some stress on the outside, emotion, there's a fight with a boyfriend, there's financial issues, there are problems with your spouse or children, it affects your brain and it's going to affect your gut. And if you already have a sensitive gut, it's going to make it even more sensitive and could worsen symptoms of bloating. Absolutely.
Yeah. So we love talking about how impactful the brain is on the gut, but that it's bidirectional because certainly, unfortunately, people have heard that some of these symptoms are, oh, they're in your head, and that's like the last thing that we want people to experience. And so that's another thing that we dispel often, that your head is heavily involved in these symptoms, but in a really impactful way through the brain gut axis. And so you do a beautiful job describing that. And again, I think helping people to understand that these symptoms are very, very real. They're just complex and impacted by things that you never would have thought would cause bloating or cause bowel problems, but they can, and they do.
Absolutely. Absolutely well said. I think too, just as an aside, sometimes patients will say, oh, I was just told it's stress. Everybody blames it on stress. And I think I always try to take a step back and say, yeah, it's easy to say stress, but when you think about it, this is why stress can do it. And if you go that extra step as you do, as Kate does, it just makes sense to patients.
Right. When you label what stress hormones are, and that, stress certainly can be emotional, but that stress has very profound physiological impacts on the body too. That I think also is what you're talking about in terms of connecting and again, validating that patient's experience.
Agreed.
Yeah. And I love the way you described the gut as such a sensory organ in such clear description, because I don't think people realize how the gut and brain are connected, but also just so much sensory ability. It can really take in, is very affected by whether it's food or gas, depending on how heightened that brain gut access is, especially like in something like IBS, how stress can really exacerbate those symptoms.
Absolutely. Absolutely. I mean, as I tell the medical students, what's the smartest organ in the body? Well, it's the stomach, right? It's not your brain, it's not your heart, it's the stomach, because it's telling you really on a second by second basis what its functional status is. Am I a little queasy? Am I full? Am I overly stuffed? Am I too hungry? Do I have butterflies in my stomach? A brain gut problem, right? Because everybody's had some butterflies before. So on a second by second basis, it's telling you its sensory status.
I love
so
that.
those of us that can lean into that gut instinct, it's real. That's another thing that you're teeing me up to talk about, that there is a gut instinct and your thoughts are connected to that. And so sometimes giving pause when your stomach is giving you some signals and then sifting through some of the cognitions and the emotions that go along with that, leaning into that and learning how to lean into that can really help guide you in terms of all the things that we navigate in the world.
I love
Absolutely.
that. So let's segue a little bit into nutrition. And this is obviously working with IBS patients that experience a lot of bloating. I'm making diet modifications on a regular basis. But I'd love you to just talk a little bit about your practice and what are some of the dietary culprits that you find frequently in your patients. And I'd love you to talk a little bit about just the notion that fiber and plant-based diets are really hot right now. And I can see why eating plant-based diets are good for us from a gut microbiome, gut health standpoint. But I think for some people, they might be overdoing it. And, whether it's too fast a ramp up or just too much fiber all a lot at one time. What are your thoughts just about diet and then, regarding fiber and plant-based diets that are really pushed on TikTok these days?
All right, wonderful. So for our listeners, remember, I'm a simple gastroenterologist, and I've just been asked a diet question from a international nationally recognized expert in diet and nutrition. So she's just setting me up to fail. But let me tell you how I do it I'm teasing. Let me tell you how I do it in my practice. I take time with every patient and I try to be very efficient, but this is the way I approach it, knowing that this is not the way a dietitian would approach it during a 45-minute visit. So when I think about common dietary offenders, I ask about dairy. So don't forget that lactose intolerance is present in 35% of adult Americans and up to 95% in African Americans and Asians. And it happens slowly over time. I ask about fructose. Remember, we don't have an enzyme that breaks down fructose. It's absorbed very slowly through co-transporters. There's a lot of fructose out there. The average American takes in 40 pounds a year of high fructose corn syrup. Yeah, I see Megan closing her eyes thinking this is terrible. And it is terrible because it causes gas, bloating, and of course, obesity. I think about healthy foods that can backfire. So cruciferous vegetables are healthy, but too much broccoli, cauliflower, Brussels sprouts can backfire gas and bloating. And I think about legumes, which can be very healthy. We're talking about galactans now. It can be very healthy, reduce cholesterol, good source of protein, but they can cause gas and bloating because many Caucasians don't have the enzyme to break it down. I ask about sugar-free candies, gums, and mints because anything that ends in OL, sorbitol, lactitol, erythritol, mannitol can cause horrible gas and bloating. And I ask about artificial sweeteners as well. Your point is a great one. I think many of your listeners are trying to become healthier, trying to shift more to a plant-based diet, which is great, and incorporating more fiber-rich foods. The problem there is sometimes eating healthfully, great for your overall health, backfires for your gut, because if you do add things in too fast, you can cause gas and bloating, but also fiber, if it goes through the GI tract and gets to the colon, ferments. And a scary fact, or maybe not so scary, but maybe a surprising fact, is a teaspoon of fiber can produce 200 cc's of gas. A teaspoon of fiber. So your teaching point, Kate, was perfect. If you start that plant-based diet, start that higher fiber diet, do it slowly, let those gut bacteria get used to it. Don't overwhelm them all at once, because if you add a huge fiber load, you're going to look like the Pillsbury Doughboy the next day.
I love that. And, it is so true. I think people it's all or nothing. And I'm going to be on a high fiber diet tomorrow and eat 50 grams at breakfast. I was just looking, I think it's the cereal Poop Like a Champion. I don't know if you're familiar with that cereal, but it's 23 grams of fiber in a half a cup. And I thought, oh boy, this is like a sprinkle on top of your lactose-free yogurt, but not a half a cup at one shot. I think, yes, I'm so grateful that you agree with me. Go slow, let that colonic environment adjust, the little microbes residing there so that you'll tolerate things better. I am so grateful you talk about sugar-free gum and mints and ask that question, because I have had so many patients come into my office chewing gum, popping the mints, and thinking to myself, okay, I got my first recommendation here.
Drinking the carbonated soda.
Right, exactly.
or even the bubbly waters, right? We think that that's a healthier choice, which in a lot of ways it can be, but all that carbonation sometimes can be really a killer on the gut.
Exactly.
Yes, absolutely.
I was smiling as you're describing the sugar because, in the Riehl household, we try to take a liberalization, moderation approach. So, just like we may eat an entire head of broccoli all together at the dinner table, then we go get our ice cream in the summer. And so the approach of moderation, but also then knowing that I live a pretty healthy lifestyle and I'm not immune to bloating just like the next person. But I think that knowing that when you can step back and take a little bit of a self-assessment of, I've been more bloated recently. Is it that summer's around the corner here in Michigan where it's not warm down in Florida all the time? So we're more likely to have, ice cream, and we're eating more of those fresh fibrous vegetables as we get them a little easier. And, so you might see this kind of uptick in bloating, and there may be some gentle ways that you can approach that through some changes. And I think that not catastrophizing around the why right away can be really helpful, especially when it comes from a stress management perspective.
Agree with all that, yeah.
IBS-C, or irritable bowel syndrome with constipation, is a common condition in which people experience constipation along with other belly symptoms, like pain, bloating, and discomfort. Sound familiar? Many people with IBS-C are willing to give up key parts of their lives in exchange for symptom relief. And because the causes of IBS-C may differ for each person, there is no one-size-fits-all treatment approach. If you're suffering from IBS-C, you may have to try a number of different medications before you find the right one for you. So don't be okay with just feeling okay. If you have IBS symptoms that continue to bother you, talk to your healthcare provider to find out if your current medication is right for you, or if it's time to try something different. The more you know about IBS-C, the better prepared you will be to speak with your doctor about the right treatment option for you.
As a psychologist in this area, I feel pretty comfortable giving patients some guidance around the breathing techniques. So we'll link our diaphragmatic breathing video that's available on YouTube in the show notes today. I also will talk with patients about exercise and gentle movement of their body. But what about some of those holistic over-the-counter remedies that I'm sure people are asking you about? The smethicone, activated charcoal is one I hear about, probiotics. Do these work? And also what are the risks to using some of them?
At heart, I'm kind of a scientist. So let's preface this whole conversation saying that for most of what I'm going to say, we don't have great data. So we'll have to rely, I've done this job for about 30 years, so I've seen a lot of patients with gas and bloating, and I try to keep up with the literature. What do we really know? So activated charcoal can bind different chemicals and can bind medications and may help prevent a poisoning overdose, but the data supporting its use for gas and bloating is essentially zero. And then you take activated charcoal, your stool is really dark, and you get everybody all excited because they think you're bleeding on the inside. So don't use
GI bleed
activated
warning.
charcoal. Exactly, to stay away from that. What about simethicone? So we know that we give that to babies for colic, biliary colic, which is really gas bubbles, stretching the colon and small intestine, cramps and spasms. What does simethicone really do? What it really does is take a big gas bubble and breaks it into little gas bubbles. It doesn't get rid of your gas, but it may help a little bit. So could you add a little bit of simethicone? Can't hurt, but we don't have great data at all. Some people use probiotics, and a concept, again, we kind of started almost a conversation with that, is that probiotics may change your gut microbiome, might change that gut flora, that delicate balance of good and bad bacteria. But the data supporting bloating is very weak at best. Matter of fact, if we looked at IBS and looked at 53 published studies in IBS, probiotics are barely better than placebo and don't do much for pain or bloating. So I don't usually recommend them, and sometimes it makes bloating worse. I think watching your diet, I think exercising, I think taking control of your constipation. Again, if it's hard to evacuate stool, it's hard to evacuate gas, and thinking about some of those other common offenders we've already discussed.
And what about the pharmaceutical treatments? So there's more rigorous research around this. Antibiotics, the prokinetic agents, tricyclic antidepressants, antispasmodics are probably the things that if people were Googling, they would find and bring to their doctor. What do you use and what might you suggest for patients?
Okay, now we actually have some data. So let's talk about data. So let's think about antispasmodics first with smooth muscle antispasmodics. The theory there is that they can relax the gut, and there is some data showing that smooth muscle antispasmodics, I'll use a generic name, hyoscyamine or dicyclamine as an example, might improve some symptoms of gas and bloating. And there's one product sold in Central America that's a smooth muscle antispasmodic with simethicone, as you know, showing that was better than placebo. So there's a little bit of data. Some people translate that to using warm peppermint tea. Peppermint oil helps spasms and cramps. But remember, it's not changing the gas content. It's really changing how you respond to the gas. Could you use antibiotics? So we use antibiotics for people with documented small intestinal bacterial overgrowth. I don't recommend it just for bloating in general because antibiotics have risk, and I would feel terrible giving somebody horrible diarrhea like C. difficile, Clostridium difficile diarrhea. But antibiotics can definitely change gut flora and treat small intestinal bacterial overgrowth and therefore improve symptoms of gas and bloating. But I want to have that documented. The best data for medications might come in the IBS with constipation field. We have 5 FDA-approved drugs for this disorder. I'm sure your listeners are very familiar with them, such as linaclotide or plecanatide or lubiprostone. Those are the generic drugs. And the data shows that in all the studies performed to date, as we improve IBS and constipation symptoms, those agents, prokinetic agents, as you mentioned, Megan, also improve symptoms of gas and bloating. Is one necessarily much better than the other? Not really. They're all pretty good, though.
Yeah. And we're going to shift in. I'm going to let Kate bring this up, but I think the constipation so often, sometimes patients get stuck on their bloating, but then I'll ask them, when's the last time you've had a bowel movement? And they're like, yeah, I go, I don't know, every 5 or 6 days. They oftentimes don't even recognize that's not normal. And so I'll let Kate take it away from here.
Yeah, I mean, I would say, and I'm a 30-year veteran too, Dr. Lacy. So I've been doing this for a long time. And most of my patients are constipated. And it's just, I don't know if this is an increasing problem in America, but I see constipation so frequently. And I wanted to mention the condition dysnergic defecation as well, which I'd love you to just quickly define. But I am really seeing this as a big driver of bloating, the constipation, and maybe even dysnergic defecation, which I think we're seeing in a lot of constipated patients. So I'd love you to describe dysnergic defecation and just the relationship. How significant is constipation in this bloating picture, from your clinical experience?
Okay, great question. So a couple of points here. One is, as you've highlighted, constipation is common. We talk about 15% of US adults at minimum. And if you imagine trouble evacuating stool, gas is handled to some degree the same way, so it may be difficult to evacuate gas. The anorectal area is very smart, and if the muscles aren't working properly, you may have trouble evacuating gas. Your point about dyssynergic defecation comes to that pelvic floor. So what I tell my patients is going to the bathroom should be really easy, right? What's the big deal? People go to the bathroom every day. It's incredibly complicated, right? So what I tell my patients is, one, it has to be an appropriate time. So if you're outside of New York and you're on 95, that's probably not the best time. So it has to be appropriate setting. Number 2, stool has to move through the colon normally. And in most people, it does. Number 3, you have to be able to sense it normally. So maybe think about a long-standing diabetic who has now lost some sensory function and actually can't sense that pressure in the rectum. It's time to go to the bathroom. They've lost that sensation. Number 4, and this is the key point, in split-second sequences, certain muscles have to relax and certain muscles have to contract. And if they are a split second off sync, patients think they're pushing to evacuate, but instead the muscles are clamping down, they're holding back. And that's what's dyssynergic defecation. It's out of sync, it's synergy. So it's out of sync, dyssynergic. And a key teaching point here is that those patients, as you well know, don't get better with medications. Usually it's physical therapy. But when their physical therapy goes well and their constipation gets better, their bloating always gets better as well, hand in hand.
Another team member, the pelvic floor physical therapist, they get another shout out. And, I just had a patient today, actually, that I was describing how, pelvic floor dysfunction could be a part of the puzzle. This is a patient that has constipation, and she hadn't yet met a doctor that had done a rectal exam. And, so she's coming up on a first colonoscopy, and we really gave a playbook today around concepts to talk with her doctor about, because she hadn't even thought about pelvic floor dysfunction. Nobody had ever mentioned that before. And it really can be a big part of, the picture, especially for women that have had babies or a variety of factors that can impact the pelvic floor.
Absolutely. So I think it is overlooked. I think some people don't want to open Pandora's box and start talking about this because it's a little bit of a longer discussion. So you just did your patient a great service today. That's wonderful, right? They're lucky they met you.
Well, there we go.
I love that. Just to go back to abdominal phrenic dysnergia. Did I say that right?
Absolutely.
Okay. Outside of maybe trying diaphragmatic breathing, are there any other evidence-based therapies for this? I should have asked you earlier, but before I wrap up, anything?
The simple answer is no. So we do think about this as being this wiring problem where subconsciously something has happened and that gas that stretches the small intestine or colon. Again, normally your diaphragm goes higher in your chest, your belly cavity gets bigger, and your abdominal wall muscles contract to keep your belly flat. It's the exact opposite. Why that occurs, we don't really know. Some prior infection, some insult, some learned behavior. We really don't know why it occurs. The best data we have, but we don't have much data, as we already discussed, is probably diaphragmatic breathing. It seems to make sense. And at least in clinical practice, by a lot of smart providers, it works. Some people have tried electrical stimulation of the abdominal wall. That doesn't seem to work very well. Some people have tried medications to fix that, but the medications really don't work. So I think we really need to focus on behavioral strategies for this.
There you go, Megan. Let's go. Let's go. You're the valued team member in this case. So real quickly for our listeners, Dr. Lacy brought up some really key factors from the diet that may be a player for bloating. Lactose malabsorption. We drink a lot of milk. We love our ice cream. There's lots of lactose-free options. But if you're experiencing bloating, that might be the first thing you might want to look at. There are some fibers that are small fibers that are fast food for our gut microbes. Dr. Lacy brought these up. Galactans or galacto-oligosaccharide. These are common in legumes. We also have another type of fiber called fructans, and they're common in garlic, onion, and wheat in the American diet. Those are also fast food for our gut bacteria. So those two types of fibers can be problematic for bloating. The other consideration is ramping up fiber in your goal to have the best gut healthiest microbiome in the whole entire universe. Go slow, make sure you're adding water, and then be careful of those sugar-free mints and additives that you might find in various granola bars and supplements, because those are poorly absorbed too. And, those types of sugars that are poorly absorbed can be food for your gut microbes. And what they do is they make gas, and gas makes you feel bloated. And there you go. A couple other lifestyle tips that I bring up with my patients is walking. Go for a nice evening walk after dinner. That can stimulate colonic motility and may move through some of that gas. And another tip that I often encourage, and we did include it in the Mind Your Gut book, is a gentle abdominal massage, which sometimes can help move the gas further down into the rectum for easier passage. So Megan, what about you? Do you have some quick tips for our listeners from a behavioral perspective?
Yes, from that behavioral perspective. And I love that Dr. Lacy labels himself a simple gastroenterologist.
It's
about the
right?
furthest thing from that.
Hello.
And another equally simple gastroenterologist, Dr. Baha Moshiri. She's another motility specialist. Back in April, the New York Times just ran this article on gas and bloating while traveling. And she was featured. She's a fabulous atrium health gastroenterologist who explained more of the physiology around it. So the high altitude of being on an airplane might slow down the muscle contractions that are needed to kind of push the digestive process through. So I had the privilege of being a part of this New York Times article as well because of the behavioral sides of gas and bloating while traveling. And I got to normalize that, if you're somebody that feels these symptoms while traveling, or you've wondered, wow, when I travel, I get constipated, I'm more gassy, I'm bloaty. And I got to be quoted saying, "Trust me, you're not the only one farting on an airplane." Never in my life did I think that would be the quote that came out. But the reality is, if you've ever seen a chip bag on an airplane and it expands, that's what can happen to all of us, and especially those that are probably more prone to IBS or other digestive symptoms. And I really think that the normalization that even if you're not traveling, but you're in class. Now, you don't want to be the person that's just letting your fart fly in class, but standing up, leaving the room, excusing yourself to go to the bathroom, sucking in, holding your stomach, holding your gas when you're out and about. It's not good. And you're not alone. Other people are experiencing this. Dr. Lacy highlighted the statistics of people that are experiencing these symptoms. And if you're doing that, you're more likely to just worsen bloating, worsen your constipation. So in the Riehl household, we have normalized that everyone poops, everyone toots. My 2-year-old says it to me all the time. "Mama, I tooted," and I'll say, "That's great." And I want everybody to kind of feel destigmatized in their normal bowel habits and their patterns. And this can go a long way. So, if you're seated around the dinner table talking about things, normalize our bodily processes. Make sure that we're having conversations about, especially with your kids, are they pooping at school? Are they going to the bathroom? Do they feel uncomfortable at school? So that we can get them the help that they deserve at a young age, instead of what I'm sure the three of us experience, where we're seated with, 50, 60-year-olds that are just starting their pathway of addressing these symptoms. So as we've kind of mentioned, gentle yoga, going for walks, thinking about the foods that you're eating. But if your belly is bothering you, don't ignore it. Get help. It might not be with a gastroenterologist. It might be with a dietitian or a behavioral health specialist. And just know that it's okay to let it go when you need to. And, that we all support that. As we wrap up this incredibly informative podcast today with Dr. Lacy, we like to wrap up by asking each of our guests the following question. So, Dr. Lacy, what is something that you prioritize when it comes to your overall health and your wellness?
So first of all, thank you. This has been a wonderful discussion. Your listeners are very lucky to have you both. I learned a lot. So what do I do? I guess, can I say 3 or 4 little things?
Please.
Yes.
So some seem, I'm sure your listeners have heard all this before. So one, I do prioritize sleep. And the reason being is that poor sleep changes sensory thresholds in your gut. And if you don't sleep well, your gut feels worse. So try to prioritize sleep. I try to exercise. So I do something 6 or 7 days out of the week. And it could just be that wonderful half-hour walk with your family after supper. It doesn't mean 3 hours at the gym. Exercise comes in different forms. It could be playing ping pong with your family. It could be any number of things, but do something physically active. Number 3, I turn devices off. People laugh at me. I think I have 4 apps on my cell phone. Sorry, guys. But turn your device off on vacation and at night at home. Don't stay connected. You need to focus on your friends and your family and yourself. And number 4, I guess what I would say, other than trying to eat healthily, you'd be proud, Kate, is I try to express gratitude. All of us are so lucky in so many different ways. And even if you're having a bad day, if you do one nice thing to somebody every day, express gratitude to that checkout clerk, to the person who helped you at the pharmacy, that 1-minute interaction, that 30-second interaction of expressing gratitude to somebody else completely changes that person's day and my day as well, right? We have so many wonderful things around us. So that 30 seconds, that 1 minute of gratitude each day can be just a life changer.
And this is why he's such a gem.
I know.
It's amazing.
I'm like, geez, Louise, the nicest guest, the nicest person. And everyone that knows you says that about you, just so you know, like the nicest, kindest individual on the planet. So I love what you do for well-being. I'm going to take every single one of your tips and incorporate them into my life. I do get my sleep, but I'm bad with the device. But that was excellent. Thank you. Thank you so much for being our guest today. You shared so much around this topic that is confusing for people. and worrisome for people, it just leading us down a scientific path, which is really the goal of this podcast, is to provide the real truth, the real science as we know it today. So thank you again for spending time with us on our podcast.
Absolute pleasure, and thank you for having me. Delighted to do it, and best wishes to all your listeners.
So next up, we are talking with Dr. Darren Brenner, gastroenterologist and professor of medicine at Northwestern University in Chicago, Illinois. And it really features, it's going to swing right in from bloating to constipation. So we're going to talk about everything you need to know about constipation. Thank you for joining us as we grow this gut health community. We hope you enjoyed this episode, and don't forget to subscribe, rate, and leave us a comment. You can also follow us on social media at the Gut Health Podcast, where we'd love for you to share your thoughts, questions, and experiences. Thanks for tuning in, friends. Thank you for joining us as we grow this gut health community. We hope you enjoyed this episode, and don't forget to subscribe, rate, and leave us a comment. You can follow us on social media at the Gut Health Podcast, where we'd love for you to share your thoughts, questions, and experiences. Thanks for tuning in, friends.